Hey everyone, Tobias Siegel with Promo Life, and today we are joined by a very special guest, Dr. Jim Bridge. Jim has played a crucial role in generating the excitement surrounding ozonated glycerin. And in this interview, my goal is to inform you, the listener, as to why ozonated glycerin is important and here to stay. Jim, thank you so much for joining us. Can you tell us a little about yourself?
Okay. I'm a small animal veterinarian. I had a practice in Orange County, California for 32 years. Then I kind of retired and moved to Oregon, and now I'm medical director of a clinic in Southern Oregon. And I do a lot of regenerative medicine and ozone therapy.
Very cool. So this whole conversation, obviously, we want to really dive into the excitement of ozonated glycerin. Like what piqued your interest? Like what got you into looking into ozonated glycerin? What was the reason for that?
I was at a lecture at the American Association of Ozone Therapists meeting in 2018, and there was a Japanese veterinarian that was talking about ozonated water and how he was treating different things. And they did all the basic research to prove how safe it is. And they wanted to find something that was as good or better than ozonated water, but lasted longer. The problem with ozonating water is it dissipates fairly quickly because
Yeah.
it's bubbles dissolved in the water instead of what happens when you bubble ozone through glycerin is that it causes a chemical reaction and makes up peroxide, and it's stable for, well, half of it disappears in 90 days at room temperature. Apparently they've frozen it and kept it going longer, but they also did research on how it kills viruses, bacteria, fungus, and protozoans. And
Okay.
interestingly enough, the fungus is killed the easiest.
That is interesting. Usually they're pretty hard to kill.
Exactly. And the only bacteria that it didn't kill completely was probiotic.
Okay. That's good.
So it's good in the gut. So it kills the bad
That's
bugs
good.
and it doesn't kill the good bugs.
Yeah, I mean, I've experimented with a little bit. What I've noticed more than anything from ozonated glycerin is like it definitely tastes different from standard glycerin. You can tell there's definitely a taste difference. It's still there's still a sweetness to it, so it's much more palatable when you compare it to like other ozonated products. Where like how long has ozonated glycerin been in use? Like where like what part of the world are people using it right currently?
Well, it's mainly been a research thing in Japan until I heard it and I started using it on my patients. And then I got a hold of Dr. Schellenberger at the American Association of Ozone Therapists, and he had me give a talk, and then I've been giving lots of talks about it later. But I looked at my electronic records for the last 2 years. I've given over 200 injections and over 30 animals for all kinds of different things, from systemic fungal infections to pancreatitis and uh, masses. But talk about that later.
Yeah.
Um,
That's
anyway,
yeah, that sounds really, so it sounds like it's being used like it's more of like a research thing in other countries as well. You've been doing a lot of research here in the States. Can you just like based upon your knowledge, like what is happening when ozone is introduced to glycerin? In your mind, what do you think is actually caused like what do you think is actually happening to the glycerin?
well, glycerin is a three carbon chain sugar alcohol. So it's got three carbons in a line, and on each of the carbons is OH, or which is an alcohol
Yeah.
group. And ozone's got three oxygens, and it doesn't like that third one, so it wants to give it away to the first thing it comes in contact with. So that singlet oxygen is very reactive with stuff. And that's why ozone, when it comes in contact with stuff that's sensitive to it, kind of disintegrates latex, and it does the same thing to the cell walls of bacteria, viruses, and fungus,
Yeah.
I guess protozoans, uh, they don't have the enzymes to counteract the peroxide reaction. So what I think is happening is the ozone is reacting with some of the glycerin molecules, and then I think it changes their charge or something. So if you have one molecule that's kind of surrounded by a group of plain glycerin, and that's why we're only getting about 1% converted over.
Okay. And like from what you're from sounds like from your experience, like as you ozonate glycerin, there is a very, very small weight increase to the glycerin from what you found. Is that correct?
Right. So if you're doing, say, a liter of glycerin, it's only going to gain about 10 grams.
Okay.
That's,
So yeah, pretty minimal.
heavier than water. So it's a
Um,
very small amount, less than 1%.
okay. So like with what's happening, when if you decided to mix ozonated glycerin with other products, do you feel like there's a reaction that's taken place? Because I know with a lot, obviously with ozone gas, it's so highly reactive with just about everything. What's your experience when you mix glycerin with ozonated glycerin with other materials?
Okay, so I mix the ozonated glycerin with propane or lidocaine, a local anesthetic, and some B12, and we inject it into joints to repair joint damage or arthritis, things like that. And I make it up in a bottle, and then I just take from that bottle and inject into the joints. And the B12, because it's bright red, um, even after a couple weeks, it doesn't change color. So normally, like
Okay.
when we're olive oil, it starts green and then turns to kind of yellow and then it turns to white as time goes by. So we're not seeing that kind of reaction. I think it's because the ozonated glycerin is kind of buffered by the plain glycerin.
Okay. No, that's really cool. And that's obviously one of the biggest concerns with like, standard ozone gas when you start mixing it with things. It definitely reacts very quickly. You can see that half-life of ozone gas drop dramatically as you mix it with other things. I mean, look at when you add ozone gas to water. I mean, it has a half-life of roughly 20 minutes. So, the 90-day half-life with glycerin is far superior than ozonated water.
Right. And in the body, it seems to last about 2 to 4 weeks.
Okay. That's really cool. Like in your opinion, like from when it comes to like safety, what have you noticed? Like any issues with safety with ozonated glycerin? Anything like that you can share?
And it's extremely safe.
Okay.
Unlike ozone gas, where if you breathe it in, your lungs are irritated and you start coughing. Um, we nebulize ozonated glycerin in water, and for some really nasty respiratory things like tuberculosis, it seems to clear it up pretty quick. Um, the only thing about ozonated glycerin in high concentration is it's very acidic and it's hypertonic, which means it's very concentrated and it's more concentrated than body fluids, put that way. And that draws water towards it. Sugar draws water towards things. So,
Okay.
uh, and that's how some of the things, like if you've ever had a colonoscopy, they give you a gallon of this horrible stuff to drink, and it's actually a sugar that you can't absorb, so it draws water, and that causes to clean out your GI tract and give you horrible diarrhea. But glycerins absorb really fast in the first couple inches of the small intestine, just like sugar is, and it's basically half of a glucose molecule. So your body every cell uses glucose to make energy. It's just dragging some extra oxygen along with it, which in the case of bacteria and viruses and unhealthy cells, it kills off those cells really fast.
Okay.
But normal cells is fine, doesn't do anything. So if you had too strong a concentration and you're injecting it under the skin, say around something, and or if you had a very deep infection, you wanted to go all the way around it and kind of flush the abscess out with it. If it's too concentrated, it stings a little bit. What we found is it's probably the acidity is the problem. So if we start adding a little sodium bicarbonate to it, bring the pH up. It doesn't seem to sting anymore.
Okay.
So I think that's part of it. So it's acidic and it's isotonic. But other than those two things, we can fix the hypertonicity by diluting it.
And what are you diluting it with, anyways?
Well, if we're giving a localized injection, then we want to stay in one spot. I often give it into the abdomen for things like pancreatitis or a lump in the spleen, stuff like that. The Because of it draws water towards it, it just kind of stays in that location, stays in the abdomen for a long period of time. When we've given it under the skin, at least in cats, um, the say the lump that I was trying to get rid of disappeared, but they had like a fluid pocket. Skin's super elastic in cats, but I think the sugar drew water towards it, and it caused that fluid pocket to sit there for about 4 weeks in the cat.
Yeah.
So that's how I know it's metabolized in 4 weeks.
Okay.
But
Um,
yeah, it's way safer than anything else.
well, that's really cool. I mean, I did some nebulization about a week ago with ozonated glycerin, and I probably had my mixture a little off. I think I did a little too high of a concentration because you could actually taste the sweetness
Hmm.
during the nebulization process. I think I did like around I think it was like 30% glycerin and 70% saline. So I would probably, I think, what's your experience as far as like the nebulization aspect? Was that too high of a concentration, or
No such
um,
thing as too high. As long as it
say
gets
what?
atomized, it's good. But I think water's probably better for nebulization than giving it IV because it's so strong. Um, Saline, I've done it in saline. Dr. Rowan's case with the tuberculosis like infection, um, I had just given him a bag of saline that I was using for local injections, and it was only 5% ozonated glycerin. And he gave it to that woman with a lung infection. And even at 5%, she said it was dramatically felt better right after the first treatment. It said, in her words, there's a YouTube video on his website. Um, it was like a warm hug. All of a sudden, her lungs could expand and she could breathe better. And that's what I found with it because I've had asthma as a kid and chronic sinus infections, and my lungs they just expand greatly when I nebulize it. And I do about 30% like you were doing. So 20,
Okay.
30, anything over 10% is probably great. You
Yeah.
probably just want
I
to feed something.
I did get it to atomize, so I got a little handheld nebulizer offline online, and it did actually surprisingly it did a surprisingly good job nebulizing it. Worked pretty well. I mean, I was definitely able to taste the sweetness. It was, seemed to be working pretty well, and it was fun to experiment with that. I think it was a really cool, easy way to use ozonated glycerin. What are the other ways like you're seeing? Like I know there's a lot of people who can use like as far as like topical use. Like how are you seeing topical use applied for like ozonated glycerin?
Okay. Well, it's kind of interesting the Japanese research on skin products because they're coming out with a ozonated glycerin product to get rid of age spots. So if you put the glycerin on your skin, you're too young, but when you're my age, you have spots all over your skin. Uh, you put it on there. One, the glycerin softens your skin up because it hydrates it, draws water towards it, right? So it hydrates the skin, makes it really soft, and the spots. What they found is that the glycerins, that ozonated glycerin, is actually dissolving the melanin particles and then causing the skin turnover to bring those spots to the surface where they just come off.
Okay.
Pretty fascinating. Um, on your nebulizer, that little portable one you got doesn't work nearly as good as the air compressor kind. So
I would believe that. So
yeah,
it took
I just
it
bought
was
one,
getting
and
sorry,
it's
it was getting caught a couple times. It would take a
yeah,
while
that's
for it
like
to
the
actually get
mist
going.
coming
So
out is not. If you hook it up to the air compressor kind, you see this big cloud come out of it,
yeah,
and you know you're breathing it in. The little
no,
one,
that
I think,
totally
is
makes sense.
a little bit on the And you read the reviews on Amazon, it's like they break super easy. I mean, if you had an infant, you're only given a small amount, that'd be fine. But I think for
Yeah.
adults, you want the biggest bang for your buck, and the air compressor kind of is basically just a aquarium air pump, and then the little tube that bubbles it through there and causes the atomization.
Yeah, and all those devices can be found online. Like you can, there's Amazon's got tons of nebulizers available from like low, like even like $10 all the way up to like $100. So they're pretty inexpensive if you want to try to find one.
Yeah, the air compressor kinds, they're like $40, like that. That's the one I bought. And so I bought both kinds just to try it out, and I like the air compressor one way better. You see a huge cloud of stuff coming out of it, so you're sucking that fog in.
Yeah.
Now,
Nice.
I also use it
Um,
as a nasal spray. I used to, well, for many, many years, I couldn't smell. And I've had chronic sinusitis since I was a little kid, and I'm 65. And for the last couple of years, I've been able to smell since I've been using Ozonated Glycerin nasal spray, about 10%.
so you're taking 10%, I'm guessing saline, mixing it with
No, just
10%
water.
glycerin, just water. Okay. And then you're just shooting it up. I mean, that sounds like a really cool way to do it, especially if you're having like a sinus issue going on. That seems like a really easy way to use it. Probably, can you use it like multiple times a day, or is that,
And twice
are
a
you
day is
restricted to use?
recommended. Um, you know, 10% ozonated glycerin is what they're using as a hard surface disinfectant in Japan.
Okay.
So if you're going to go on an airplane, the mask really doesn't do anything for you. But if you spray the mask with the ozonated glycerin and then take the ozonated glycerin nasal spray before and after your plane ride, you're not going to get sick on your trip.
So I think this is really good because like the biggest questions that I keep on getting about ozonated glycerin is like, okay, so if I have ozonated glycerin, in my possession, what am I going to do with it? So it sounds like it's a fantastic, disinfectant. So you can dilute it down 10%. It can be a great surface disinfectant. You can, probably put it on cuts. You could probably, use it as a nasal spray it on your mask. And it sounds like you can also use it as like a skin enhancement product as well. So you can apply it to your skin. It helps with age spots. I think I read somewhere that even in Japan, they were mixing it with like hyaluronic acid as well. They were doing ozonated glycerin and hyaluronic acid.
Yeah, I think I have. Well, here's all the research I have from Japan that I got this week. So I'm still going through it. But yeah, they did. Um, and it's kind of interesting with on the skin fibroblast. It penetrates the skin, rehydrates it, kills the bad bugs on the surface. Oh, they're also using it for atopic dermatitis or eczema.
Okay.
Seem to clear that up, and it increases the cell turnover. So any damaged skin cells, it kind of sloughs them off, and almost a stem cell like repair without stem cells.
That sounds really cool. Obviously ozonated glycerin, what I think is fascinating about it is it's soluble in water and it's also soluble in oil. So are there any advantages of mixing it with like an oil-based product? What have you found about that?
Well, if you took it orally, I think it's going to clear out the oral cavity, which is the dentists are really excited about it for periodontal disease. And just as a little aside, I started putting some in my dog's drinking water. I have pugs and they have crooked teeth, so they get, even though they get their teeth cleaned yearly, they still get bad breath. And just putting a little bit in the water seems to be helping their breath. So,
Okay, cool.
oral rinse is another way you can use it, especially if you have bad gums and things. It'll fix the oral cavity.
Yeah,
But
that sounds
back
like a
to what you were
fantastic
asking
use.
me about. When you take ozonated glycerin orally, it's a sugar, so your body just sucks it up out of so it only gets as far as the first few inches of the small intestine. So it's not going to get past that. So that's why it's not affecting the microbiome. If you had a bigger problem, with candida or other problems in your GI tract further down, then you need to use the oils. So you can mix the two together and get the best of both worlds, and make it taste better,
Okay.
because we both know that ozonated oils have a distinct taste.
They do. So if you mix glycerin, ozonated glycerin with ozonate with an oil, let's just say like an MCT oil, it sounds like it'll make it farther down the intestinal tract from what you're saying.
Right. Yeah.
Okay. And
Well, it
then
makes
if you're
it
mixing it with water, if you're mixing it with water, it's only going to hit the upper GI from what it sounds like.
right. It's only gonna hit the stomach and the small intestine.
Okay, very cool. Yeah, I mean, it sounds like with all the like, there seems to be a lot of uses on the oral side as well. I mean, I've always envisioned trying, taking ozonated glycerin, mixing it with like a little bit of water, maybe adding some peppermint oil, and using it as like a mouthwash. Because we see a lot of people using ozonated water; it works really, really well. Even ozonated oils, but the biggest complaint with ozonated oils, I mean, it works incredibly well, but there is that taste barrier that some people cannot get past. So, and obviously, based upon how, with my experience with ozonated glycerin, it has a very pleasurable taste. And I'm sure if you added like other types of like essential oils such as peppermint or cinnamon, it'd probably even taste even better.
Yeah. I think that's
Have you?
well, it's basically you're giving it sugar, but it's killing the cavity causing bacteria. So get the best of both worlds. Tastes
That's
good.
really
It
cool.
kills the bacteria. It doesn't cause cavities like sugar does.
So with it being it sounds like it's a single glucose molecule. I mean, it sounds like it's slightly different than sugar. It seems like it's almost like it seems like, in my opinion, it almost like acts like a Trojan horse from what it sounds like from with the way it's described. Can you elaborate on that a little bit?
Okay, so bacteria and viruses, stuff like that, they don't have any antioxidants in them to counteract an assault by, we'll call it singlet oxygen, right? So when the peroxide releases, it's releasing a single molecule of oxygen that has a lot of high energy electrons in it. And when it hits the surface of the virus, it literally blows it apart. And it does the same thing to bacteria. It even gets into biofilm where antibiotics won't. So biofilm is a slimy layer of bacteria that kind of has a protective coating around it, which makes really hard for antibiotics and things like that to get into it. But ozonated glycerin, got an article right here on it, kills biofilm. It destroys the biofilm and goes in and kills the bad bacteria that were hiding underneath that blanket of goo, so to speak. And other cells that don't have good antioxidants, neoplastic cells, are weird and they don't use oxygen. So when they convert sugar to energy or ATP, they do it anaerobically and it's very inefficient. So if you see uh, a lot of weight loss and stuff with diseases like that, but if you're using oxygen to burn the sugar, you produce 38 ATPs instead of 2, so 16 times better utilization. So the wasting we see with certain diseases is turned around. The other thing that's most important with ozonated glycerin, it gets rid of pain.
Oh, say that one more
Uh,
time.
it gets rid of pain.
Okay. Okay. Nice.
There's a pain killing aspect to it. That's so when you have, say, you had inflamed gums, you have gingivitis, they hurt, right? And
Oh yeah.
when you put the ozonated glycerin, even if it's just a mouthwash that's diluted down to 5% or so, uh, gets rid of that pain from the oxygen effect. So after I got frustrated with Western medicine, I learned the traditional Chinese medicine. And the way they described pain 1,000 years ago was they call it blood stagnation, or stagnant blood's dark, right? Not enough oxygen. Or they would call in the old days they called it cosmic chi, but we call it oxygen. And if you use ozonated products, then it's like turbocharging cosmic chi, so it's even better. But that's how they described it. And that oxygen gets rid of the pain, both in the nerve endings, in the tissues themselves from the inflammation. It has a great anti-inflammatory effect.
Is there any concern with like ozonated glycerin regarding like isn't glycerin naturally like somewhat antibacterial? And I'm sure if it's
It
ozonated, it
does in
creates
high
even more.
concentrations. Just
Okay.
like there's a product that they use in dentistry. It's a xylitol product. Xylitol is another
Yeah.
sugar alcohol, but it's super toxic to dogs and cats and birds. And if you take too much, it's a laxative also. But we don't see that problem with glycerin. Uh, but the xylitol, it's just the sugar alcohols have a inhibitory effect on bacteria, viruses, and fungi. But you have to
Okay.
be at fairly high concentrations of plain glycerin, like 80% or better.
Okay.
We're getting much better at tiny dilutions.
Okay. Yeah, I mean that's one of my biggest issues with like a lot of these sweeteners out there. I mean, I had an issue with my dog. It found some toothpaste not too long ago. We unfortunately wasn't at a quantity to, cause any issues, but it always scares me having these other types of like, alcohol sugars around, but it sounds like glycerin is safer. I guess it's from what it sounds like it's even if a pet decided to lick it up, it's somewhat safe. Is that correct?
It's super safe. Um, I don't know if we could do an LD50 study on it because you'd have to drink so much of it. Well, one, it costs a fortune.
Yeah.
But even a small animal, I actually injected it into a rat the other day. It had a surgery to take a lump off, and we put it in for after the surgery to see if I keep it from coming back.
That's no, that's really cool. I mean, from based upon everything that you've said, like ozonated glycerin can be used. It sounds like there's a lot of awesome uses medically speaking. I mean, it sounds like from individuals wanting to use this at home as well. They can use it as like an oral rinse. They can mix it with water, dilute it down. They can use it as topical application for skin enhancement, for disinfecting. They can also use it for surface disinfecting. It seems like there's just like a ton of uses that anybody in general can find with ozonated glycerin, whether it's nebulizing, whether it's orally consuming to help with like an upper GI issue. And I love the fact that it doesn't kill the probiotics of the body. That's always a big concern with ozone in general and even ozonated oils. But it sounds like if you want it to reach that area, you can actually mix glycerin, the ozonated glycerin with oils for that additional benefit if needed.
Mm-hmm.
Where do you see ozonated glycerin moving forward in the future, especially with medicine?
Well, the Japanese are trying to get a drug patents, but I don't see that happening in the United States with the way the FDA is right now. But those of us that do alternative medicine, and as long as you get a signed consent that it's an experimental use, and there really aren't any downsides to it, it's super safe. Um, as long as you have informed consent, then I don't have any problem with veterinarians, doctors, dentists using it. Um, it's much safer than anything we get from the conventional drug companies today, except for the
Yeah,
placebo pill, which is probably the safest thing they ever produced.
that is true. No, I like that. So it sounds like you're going to continue experimenting with it. Are you doing any more speaking engagements anytime soon, or is there anywhere that people can learn more information from you about ozonated glycerin?
Sure. I'm giving a workshop with Dr. Rowan and his practice next month. If you go to Dr. Rowan's website or his YouTube channels, you can see the podcast we did. And we're going to do a 4-hour hands-on thing. We're going to have it on Zoom too, so I think he's going to have people be able to watch remotely as well.
That's
And
awesome.
let's see, in March, I'm going to the International Academy of Biological Dentists and Medicine. It's in Texas in March. And then
Okay, good.
in May, we're going to the American Association of Ozone Therapists convention in Dallas in the first week of May.
Okay.
And I'll probably do
That's
Frontiers again fall.
That's awesome. Yeah, I mean, I'm glad to see it sounds like you're hitting up the dental side for information, the medical side. Obviously, Frontiers is a mixture of dental and medical. I first heard about this from you. I think we chatted back in May of this year. We started to really see some interest peaked on it. And we're really excited to see where this moves forward. I mean, the whole idea as far as like ozone in general or oxidative medicines is just, to me, it's just such a phenomenal way to, like to see things move forward. And I think we do need new excitements, from time to time to keep this amazing treatments flowing. And I think ozonated glycerin, it sounds like it's got a lot of amazing uses, not only at home, but also in the clinics and in the veterinarian side. I'm just super excited to see where this goes. And honestly, it's people like you who have moved this forward. I mean, without you, I don't think we would be talking about ozonated glycerin. It sounds, you did the legwork, you did the speaking, you got people engaged. I feel like you've created a movement, and I'm really excited about as far as what you have actually done.
Thank you. Well, I probably treated several hundred patients with it and zero side effects. That.
That's important. That's an amazing stat. Zero side effects. That's what people want to hear.
Yeah. So even if it didn't solve the problem completely, it got rid of their pain and made them feel better. So, as
I
a
mean,
palliative thing for terminal diseases, it makes them feel good and it gets rid of their pain. So even if they just take it orally, it makes a huge difference.
I think that's awesome. Like, what do you think about the idea of like even like ozonated glycerin, in a suppository, or you're taking it, rectally? Because a lot of people do stuff rectally with ozone therapy.
If you could find a polymer that keep it from melting so quickly, that'd probably be fine. It's going to have about the same effect as you would with the oils.
Cool.
They're absorbed when you take the oils in the suppository rectally. It affects the local area, and then it goes through the mucous membrane into the bloodstream, and then it goes from there to the liver. The portal vein goes into the liver, and it'll help detoxify the liver as well. When we put it in the abdomen, it goes into the liver, and I've seen some. I had this one case. Saw him yesterday. So Wally came from Arizona, and he had a systemic fungal infection. During dust storms in the Southwest, there's fungal spores in the soil, and if you breathe it in, normally your body walls it off. But if it gets a hold of you and starts taking over your body, then you die pretty quick. And
yeah,
Wally had it completely destroyed his liver, and after the first treatment, he started eating better and putting weight back on. And after a couple of treatments, his liver went back to normal because of a biopsy, and it said it was completely destroyed and only scar tissue. And he regrew his liver in about a month.
That's amazing. I mean, I know that's one of the organs that can regenerate itself, but usually when you say scar tissue, that's not. Yeah, that's. I mean, that's amazing. That sounds like he has his life back, and he's got a whole new way to move forward, which is awesome.
Happy, so that was over a year ago. So I give him a treatment once a month just because we don't want it to come back.
Well, that's awesome. That's really cool. So Jim, I think this has been a fantastic interview. I really appreciate the time that you've given us. This is going to be really helpful for a lot of people understanding more about ozonated glycerin. and what the potential uses are for it. So we really appreciate it, everything you've done. And then look out for Jim, any speaking engagements that he's going to. A great way to like learn more information. There's going to be a lot of articles coming out about it in the near future. I can guarantee you. I can guarantee that. So everybody who's listening, keep an eye out for this, and let's see what else comes up about ozonated glycerin, and let's open up a whole new chapter. And we're excited to see where this leads. But Jim, I really appreciate it. Is there anything that you'd like to say before we sign off?
It's safe and effective. How's that?
I like it.
It's the safest thing I've ever found. It's everything you use can be toxic, but this stuff is about the most benign stuff I've ever seen, but does a fantastic job of getting rid of all the bad bugs.
So we're talking about something that is truly safe and effective. Okay.
Yes.
Excellent. That's what I love to hear, and that's exciting. Well, hey, Jim, thanks so much again. We really appreciate your time. Okay.
You're welcome. Thank you.
Thanks for watching. Check out our other YouTube videos for more information, and be sure to follow us on social media. Make sure to hit that like and subscribe button and hit that notification bell for future videos.